Tonight, many health officials are adapting to increasing guidance for people to stay at home.
Paul Gessler talked to a Maryland doctor who, like many, has increased his telehealth visits to continue caring for patients.
This is how more and more doctors are seeing their patients, a virtual doctor's office experience where providers can screen patients and also limit the risk of exposure to themselves and their patients.
Obviously, they can't examine a patient, but they can really do pretty much everything they need to do via telehealth.
Internal medicine Dr. John Lowenthal sees half his patients these days through an online portal.
If someone has mild symptoms and we do a telehealth visit and they're not really sick, if they don't really want to be tested, we just quarantine them at home. I think that's probably the safest thing that they can do.
Lowenthal says results just came back for his first COVID-19 positive patient, who he tested a week ago.
The flu test takes 15 minutes, and then once that test is back, if it's negative, we send them home for self-isolation at home until those results become available.
Tests are limited, so they're trying to limit to those who need them.
We're going to categorize you as a low risk.
Sinai Hospital began virtually screening people nearly 2 weeks ago. Callers here are referred by their primary care doctors.
Well, it is challenging because you can't examine a patient, but really for this particular situation, you could do a good screening to make a decision about testing by talking with them.
Insurers are beginning to cover more telehealth visits. Last week, Medicare announced it would cover telehealth services, and providers may waive or reduce cost sharing. For those doctors, telemedicine gives them another tool.
Patients are adapting very rapidly, and I suspect once this pandemic is hopefully over soon, I think the telehealth is really here to stay for many of our patients.
Now, patients can also upload pictures in this portal. On Monday at Calvert Internal Medicine Group, they had 90 telehealth visits. That compares to an average of 5 a day before the pandemic. I'm Paul Gessler for WJZ.